Hello, today I'm going to discuss about chickenpox. Chickenpox is very common childhood illness and caused by a virus called varicella. It starts rash, bump, their small yellow blister, affect whole body, including mouth and genitalia, can be painful. They then open before scrubbing over. And these are very itchy, can make your child very miserable, isn't it? They may have temperature, a cough, a runny nose, and basically child are able to pass the virus to other from day before the rash appears until the last spot scabbed over. They nearly need any treatment unless they are very newborn child, and because they have very weak immune system. So for that reason, for newborn we need to give treatment. And so now what you can do to help your child. So it is very distressing, for parents, for child. So actually there are no active treatment. You can give regular paracetamol to come down the temperature, antihistamine to help itching, drink plenty of fluid like ice lollies if not drinking much, calamine lotion you can give, and sodium bicarb bath for each, pat dry after bath rather than rub, dress in loose cloth, don't keep ibuprofen and aspirin unless it is advised by doctor, cut nail and apply hand mitten at night to reduce damage to the skin. Too much scratching is not good, isn't it? How long it will last? Usually crest over by 5 to 7 days after the rash first appears. Highly contagious until spot has dried and scabbed over. Avoid nursery school 5 days from the rash onset and until all spot scabbed over. Avoid contact with newborn babies, people with weak immune system and pregnant women until all the spots scabbed over. If concerned, you have to contact your GP. There is some chickenpox vaccine, not it is in regular vaccinations, but you can do vaccine privately because you can give it if you think your family members are at risk of complication. Now the main thing you have to know aware about the features that when you'll be worried. So red features mean blue lip, too breathless to talk or interdrink, become pale, mottled, feel abnormally cold to touch, become extremely agitated, confused, and very agitated, confused, very lethargic, develop severe headache, neck stiffness, balance problem, has a fit or seizure, has a rash that does not disappear with pressure, that we call glass test. Then in that case you have to take to the emergency department in NHS area, call 999. And if these red signs are not there, but some of the concerning signs like we call amber sign, increasing pain and redness in between spot, new blister spot appear in 7 days, temperature 5 or more days, seems dehydrated like sunken eye, drowsy, not passing urine for 12 hours, rash spreading in the eyes, have extreme severing and complaints of muscle pain, is getting worse if you are worried, and a parent and is pregnant and has not previously chickenpox. Contact with pregnant women who had not previously had chickenpox, person with weakened immune system who has not previously had chickenpox, or a newborn baby. The contact should ask advice from the healthcare professional. So in this case, you can contact your GP surgery or NHS area 911. If it is symptom persists 4 hours or more and not able to speak with anyone, reject that your child not develop any red sign. If red sign, you have to go to emergency immediately. And green feature, of course, none of this whatever I have mentioned not there, but continue provide your child's care at home. Still, if you are concerned, speak to health visitor, local pharmacist or NHS area 111 call. Avoid nursery or school for 5 days from the rash onset until all spot fully scabbed over. You can provide self-care, continued the care at home. If you are still concerned, you can anytime talk with a visitor, local pharmacist or child NHS 111. So that all about chickenpox. So children who are young people who are unwell and have a high temperature should stay at home. They can go back to college or school or childcare if they have no high temperature and they are well enough to go there. So that's all about in nutshell chickenpox. Hope it will help and it have helped your awareness about it. We'll talk with another topic next time. Bye for today.